What are the types of hysterectomies for reproductive cancer? When it comes to treating reproductive cancers, understanding the types of hysterectomies is crucial. Hysterectomy is the surgical removal of the uterus and is often a key treatment option for cancers like cervical, endometrial, and uterine cancers. The type of hysterectomy performed depends on the extent of the cancer and the specific needs of the patient. First, we have the partial hysterectomy, also known as supracervical or subtotal hysterectomy. This procedure removes only the upper part of the uterus while leaving the cervix intact. It is important to note that this type is generally not recommended for cancer treatment since it may leave behind cancerous tissue. Instead, it is more commonly used for non-cancerous conditions like fibroids or endometriosis. Next is the total hysterectomy, which involves removing the entire uterus along with the cervix. In this case, the ovaries and fallopian tubes are usually left intact unless there are specific reasons to remove them. This is the most common type of hysterectomy for early-stage cervical or endometrial cancer. Then we have the radical hysterectomy. This is a more extensive surgery typically reserved for cases of cervical cancer or advanced reproductive cancers. It includes the removal of the entire uterus, cervix, surrounding tissues, and the upper portion of the vagina. Often, pelvic lymph nodes are also removed to check for cancer spread. This procedure is essential for addressing more aggressive or advanced disease. Another option is the hysterectomy with salpingo-oophorectomy. This combines a total hysterectomy with the removal of the fallopian tubes and one or both ovaries. Removing the ovaries leads to surgical menopause if the patient has not already gone through natural menopause. This approach is common in treating endometrial and ovarian cancers or when there is a high risk of cancer. The surgical methods for performing these hysterectomies can vary. An abdominal hysterectomy involves removing the uterus through an incision in the abdomen. This method is often used for larger tumors or when cancer has spread. A vaginal hysterectomy, on the other hand, removes the uterus through the vagina without external incisions. While this method allows for quicker recovery, it is less common for cancer cases due to limitations in access and the extent of tissue removal. Minimally invasive techniques, such as laparoscopic or robotic-assisted surgeries, are increasingly used for total or radical hysterectomies. These methods involve smaller incisions and can lead to potentially quicker recovery times. In summary, the choice of hysterectomy type is influenced by the type of cancer, its stage, and how far it has spread. Radical hysterectomy is the most comprehensive option for cervical cancer, while total hysterectomy is common for endometrial and other reproductive cancers. It is essential for patients to discuss their specific situation with their healthcare team to determine the best surgical option for their diagnosis and overall health.